you talk about side effects, essentially the main side effects between some of these tyrosine kinase inhibitors is it can cause sometimes rashes, fatigue, high blood pressure, and diarrhea are some of the more common ones that we see as well too. Immunotherapy and the side effects associated with that, the more common ones can be rash, hypothyroidism, or diarrhea. But typically, when I talk to people about immunotherapy as well, so I tell them that immunotherapy essentially functions as a way to sort of bolster our immune system, essentially, and build it back so that it can help surveil and look and try to fight the cancer as well too. And as a result of stimulating that, some of the side effects that are reflected here and some that I have not mentioned as well too that can be more severe can be what we call more autoimmune like side effects, where our instead of our body attacking the cancer, our immune system ends up attacking ourselves, and that can cause other sort of more severe damage to lungs, liver, other areas, but are generally rarer, I would say, in general as well too. But something to discuss in terms of if you have autoimmune conditions, it is something that you'll need to speak to your oncologist regarding using immunotherapy or not as well too, as folks with autoimmune conditions may be at increased risk of autoimmune side effects as well too. And if you look at the survival by stage, typically, like we said, those that have a localized kidney cancer, the 5-year survival rate is close to about 93%. So very good if it's caught early. If it's more regional, maybe closer to stage 2 to 3, and closer to 3, maybe closer to 75%. If it is more stage 4, then you're thinking more potentially closer to about 15% as well too. And the overall 5-year relative survival is about 77%. But I will say, I think that our field has changed dramatically with the usage of immunotherapy and then some of these targeted treatments that are just coming to light as well too, and more to come as well. So my take-home points really for if someone has kidney cancer, if you have a localized kidney mass, to talk to your doctor, your urologist, your medical oncologist about options depending on your stage, your age, and your medical problems as well too, and talking about that decision between partial and radical nephrectomy and determining the results of surgery if there's any additional treatment that's needed or not as well too. One should also have a conversation regarding if one requires genetic testing or not, if you qualify. And then if you are stage 4, treatment will really be based on your type of kidney cancer. Typically, we are utilizing a biopsy in that instance as well too. And we typically utilize medications such as immunotherapy or anti-blood vessel medications as well too.